Now, the Minister of Higher Education, Science and Innovation, Dr. Nzimande, has launched the country's first ever nuclear medicine research facility. The Nuclear Medicine Research Infrastructure Centre is located within the premises of the Steve Biko Academic Hospital in Pretoria. The centre has been hailed as a one-stop shop for medical nuclear imaging and diagnostics. It will assist in the treatment of cancer and other diseases. The centre is dedicated to the development of medicine and clinical research and will benefit not only South Africans but the continent and the world. It will provide consolidated expertise in nuclear technologies and medicine and biosciences, creating significant research, development and innovation capacity in South Africa. For more reaction to the launch, we are joined now by Salome Meyer of the Cancer Alliance. A very good evening to you. Thank you so much for your time. I mean, the centre is being hailed as a one-stop shop for medical nuclear imaging and diagnostics. What makes it so special?
Thank you and good evening to your viewers. I think this is an exciting moment in South Africa's history for cancer care, and not only just South Africa, but for Africa, that we can be at the forefront of new technology that is going to be available for Africa. For so many years, Africa has been denied some of these treatments, and the fact that we as South Africa can now with this centre become the front door, opening it up to Africa, makes it absolutely exciting news.
What are some of the treatments that you think have led to the continent at large being denied access?
Well, if we actually do know that the majority of Africa do not necessarily have access to radiation treatment, the fact that this centre, with the research and as well as the training of nuclear scientists, will open up the new technologies that are available for Africa and for treatment in oncology. And here we have to actually look at what the centre can actually provide in terms of treatment aspects. When we start looking at the combination of chemo treatments, your immunotherapy such as your monoclonal antibodies, together with the radiation treatments, all of that is new developments that is part of targeted therapy that for many years us as Africans we were saying, but that's only available for the very high income countries. Now we can start saying, wait a bit, it's becoming available for Africa and Africa's people as well. We also need to understand that HIV, people living with HIV, there's a high burden in Africa. And people living with HIV is when treating them with radiation therapy is far more complex. And even in terms of this centre, they will provide us with better outcomes, treatment outcomes, and lessons that we can learn of how we can manage our patients better in the future.
I mean, I asked you the question because, some public health institutions in South Africa, as burdened as they may be, also boast highly skilled oncologists and access to cutting-edge technologies, making them a formidable competition from private counterparts. But the ability of patients to access the best and most affordable cancer treatment, both in the public and private sectors, is rapidly diminishing because there are a number of contributing factors like poor planning, capacity, and elements of corruption.
I think we need to distinguish between the new innovation as well as the fact that we have not been able to manage and plan for cancer appropriately. So in this phase with this project, we're looking at innovation and we're looking at the future. And I think that for me is exciting, that at least South Africa can be at the forefront. We do know of the investment of the Department of Science and Innovation, as well as many other aspects that in terms of gene therapies that are being looked at. However, that does not say that from a ordinary radiation therapy treatment perspective that we do not need to start looking at the gaps that are currently there. And this is where I do think that the NHI can play an important role in terms of public-patient private partnerships with regards to the gaps that are there. And let's see, I mean, the Gauteng crisis is one of the examples.
Yeah.
I'm saying that if the NHI had been in place already properly, we wouldn't have had 3,000 patients waiting for their treatment. So we need to divorce the two from each other.
And in your offering to advance the healthcare space, more so because there's an increasing number of cancer patients in South Africa, breast and cervical cancer being the most common and the main cause of cancer deaths in women, what other research will you be bringing to the forefront to curb the numbers and perhaps also create a sense of awareness before it's too late?
The reality remains that we need to start looking at first of all, the care pathways for cancer treatment. And that means when we start looking at cancer and the early diagnosis of cancer, we need to start at the primary health care. Is our primary health care centers capacitated with regards to early diagnosis, and is there proper care pathways for them to, in fact, access the treatment at the tertiary centers? That currently is not available, and that is what we should be looking at, whilst we're also looking at the future in terms of new technologies, local manufacturing. I mean, if I just consider the fact that monoclonal antibodies can be produced in this country. However, what we do not have at this stage of the game is the global north that is maintaining the whole concept of patent information, etc., and that we cannot access technologies that can actually open up treatments for the global south.
Yeah. What about the challenges around the lack of diversity of stem cell donors in South Africa, making it extremely difficult for all diagnosed patients to find a matching donor?
There, in that aspect, I think what is urgently required is a change of our current legal system with regards to that. We really need to start looking at what it is in terms of our diverse population, and unfortunately, our legal system does not allow for that diversity. So there's many aspects within the legal system that is prohibiting access to cancer care. The Cancer Alliance will be releasing a document within the next week or so with regards to a legal framework, where we're particularly highlighting some of the aspects in terms of legal gaps that exist for cancer care access.
And very quickly, before we let you go, perhaps talk us briefly about some of the primary objectives as a centre, what you're aiming to achieve.
The Cancer Alliance is focused on equitable access for cancer care, and that includes timely access for cancer care. So we are a non-profit company where we are, our members are all cancer non-profit organizations throughout South Africa, all of them actually delivering a very dedicated service to patients and their families at grassroots level. Unfortunately, these organizations do not have the ability to advocate for cancer at a national level. So the Cancer Alliance becomes the national body that advocates for equitable cancer care, and we recently have launched a plea to the Department of Health for the establishment of a national Cancer Institute in South Africa, where we believe that such an institute will be the overarching body that will be able to bring all cancers together under one umbrella, as well as ensuring that there is a patient voice in such an institute.
Very well. Thank you so much for your time, Salome Meyer of the Cancer Alliance, talking to us about a centre that has been hailed as a one-stop shop insofar as diagnostics, and cancer research is concerned.